Okay, hello everyone. I'm gonna do a video talking about how to check for the 12 cranial nerves. This first nerve we're gonna talk about is the olfactory nerve. Usually this test is omitted unless we have suspicious of an injury in the inferior lower frontal nerve. So for this, I have my friend here, Jimena. She's gonna be my patient for today. And I will ask Jimena to please close your eyes. And I'm gonna put something on your nose, and I want you to identify which type of smell that you have. So first off, I'm gonna start with this. So please tell me, what do you smell?
Coffee.
Okay, keep your eyes closed. Now, I want you to smell this. I'm gonna start with this. 1 second. Okay. Do you smell something?
Mint.
Okay. So as you saw, she identified both smells correctly. You can open your eyes now. And this is all for the first olfactory nerve. Okay, now we're gonna check for cranial nerve number 2, which is the optic nerve. This is the nerve that will take the signal of the visual acuity all the way to the brain. So to do this, we must use a sneller chart over here. And we're gonna ask our patient to please try and read as much as she can about the letters in the sneller chart. This is gonna be the first part of the optic nerve examination. So please, Jimena, would you try to tell me the letters you see?
E, F, P, T, O, C, L, P, E, D, P, E, C, F, D, E, D, F, C, C, P, F, E, L, O, P, C, D, and I don't see anymore.
Okay. This is part of the examination. She saw at around 20 to 25. I'm not an ophthalmologist yet, but she has a very good visual acuity so far. So we're gonna now do the second part of the optic nerve examination. I will ask you to please, with your both eyes, I'll try to tell you if you can see my finger. So, do you see my finger here?
Yes.
Okay. Do you see my finger here?
Yes.
Do you think you can see my finger at the same level on both sides?
Yes.
Okay, that's good. She has a very good optic acuity. So this is all for the second nerve. Now we're gonna assess cranial nerves number 3, 4, and 6, which are oculomotor, abducens, and trochlear. So to do this, we must use a flashlight. Unfortunately, due to technical reasons, we don't have the correct flashlight to use this. I'm gonna use the phone's, which is not recommended since the phone's flashlight is very strong and it could damage the pupils. So I'll do it as farther away as possible to not damage my patient. So first off, I want to see how her pupils will react towards the light. So I want to see if they are gonna dilate with the light. They did. They reacted the same way. That's important. Now I want you to please follow my finger. Keep your head still, and I want you to follow my finger. Okay. Okay, that will be all for the cranials 3, 4, and 6. I just checked that her eyes moved simultaneously. There are no incidences of any damage towards the nerves. Both eyes acted the way it should, so everything is fine. Now I'm gonna assess the cranial nerve number 5, which is the trigeminal nerve. This is in charge of the muscles and the face. So first of all, I'm gonna start with a sensitivity test. I'll ask my patient to please close her eyes, and I want you to tell me, when do you feel when I am poking you with this? Okay?
Okay. Yes. 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 Yes.
Okay. Now I will check for some muscle movement. Please, I want you to clench your jaw when I tell you, okay? Clench your jaw. Okay, relax. Clench your jaw. Relax. Now I want you to please open your mouth and try to resist me closing your mouth, okay? Okay. Everything reacted as accordingly. So this is how you check for cranial nerve number 5, the trigeminal nerve. Now we're gonna assess cranial nerve number 7, which is the facial nerve. To do this, I'll ask my patient to do several movements with her face. So first of all, I want you to close your eyes and try to resist me open them up, okay? So I'm gonna touch your face Okay, she resisted. Please open your eyes. Now I want you to frown. Okay. Now I want you to blow your cheeks and try me resist them. Okay. Okay, that's good. Lastly, I want you to please show me your teeth. As wide as you can. Okay, that's good. Thank you. That's all for the cranial nerve numbers. Now we're gonna assess the 8th cranial nerve, which is the auditory nerve. So to do this, there are several tests we can conduct. First of all, I will try to see if my patient can hear the rubbing of my fingers in each ear. So I want you to tell me if you can hear.
Yes.
And here. Does it hear the same way in both ears? Okay. The second test we can do is the Rhines test. Unfortunately, we do not have a tuning fork, but we can improvise. So I'll use my fingers. I'll try to see if you can hear my fingers on both sides, and if the conduction is bilateral. So, see? Does it hear the same way in both eyes? Ears? Sorry.
Yes.
Ears. Okay. So the other test we can do is the conductive test with the mastoid bones. Unfortunately, we don't have either the tuning fork for that, so we're gonna leave it as it is. Okay, now we're gonna check cranial nerves number 9 and 10, which are the glossopharyngeal nerve and the vagus nerve. For this, I'll ask my patient to please open your mouth as wide as you can. Take out your tongue and say ah. Okay. Why am I doing this? Because I want to check the movement of the uvula. Now I need to check for the gag reflex. It's important to mention that the gag reflex may or may not be present, and that's totally normal. So once again, open your mouth, get out your tongue, and okay. I touched the back of her throat, and there was no gag reflex, but that's okay. Now we're gonna check for accessory nerve, which is the cranial nerve number 11. To do this, I'll ask my patient to please shrug her shoulders upwards and resist me forcing them down. Please do so. Okay. And now I want her to resist my hand moving her jaw. So, okay, resist and resist. The force was equal in both sides, and the shoulders were both moving at the same time, so everything is okay. Now we're gonna check the last cranial nerve, which is the 12th, and is the hypoglossal nerve. So to do this, I'll ask my patient to please protrude your tongue. Okay. Now I want you to please move your tongue laterally, and I want you to please put your tongue inside of your cheek and resist me forcing it. The other side. Okay. As expected, everything was normal. The movements were correct. When she protruded her tongue, it went downwards, meaning that there was no lesion or damage, because if there were a symptom of a lesion, the tongue would move towards this side of the lesion. And this was not the case, therefore everything is normal.